Face reading. Let's talk about rheumatoid arthritis. Rheumatoid arthritis is a common acute or chronic inflammation of the connective tissues. This disease is very common, especially among the middle-aged and the elderly. Women are more likely than men to develop this disease. The common symptoms of rheumatoid arthritis are symmetry and migratory pain in the joints and muscles, accompanied by signs of inflammation such as redness, swelling, and a warm sensation. This disease is related to factors such as hemolytic streptococcus infection, humidity cold, overexertion, physical weakness, poor circulation of qi and blood, compromised immune system, injury, and malnutrition. The facial reading. A small, hard, fleshy knot on the upper part of the helix is called a rheumatoid nodule. Clinically, it is found that patients having rheumatoid nodules often suffer from hyperostosis or arthritis, as seen in the picture below. Therapeutic methods. If you have rheumatoid arthritis, you should treat it as soon as you can. If untreated, it will cause great inconvenience. The dietary advice would be to eat more easily digestible, high-energy foods to enhance your physical resistance. Eat less pungent, cold, and greasy foods. Exercise. During the remission period, do appropriate exercises to help improve the function of joints, such as joint abduction and lifting. During an acute onset, lie in bed and avoid strenuous exercises. Lifestyle. Keep the joints warm. Avoid going out on cloudy days with overcast sky and on rainy days. Do not wear damp clothes. Dry your body immediately after bath, as seen in the photo above. Moxibustion. Moxibustion can dispel wind, disperse cold, and eliminate dampness to relieve pain. Apply first to the Zhu Li, Sanying Jiao, and Tai Chi points, which nourish the liver and kidney and replenish qi and blood. Then apply to the Ashi point to dredge the collaterals and relieve pain. Finally, apply to the Dashu and Yangling Quan points to relax the tendons and joints. Apply moxibustion to each point for about 15 minutes once a day. The Zuzanli point is stomach 36 as seen in the photo above. Next, we massage. So press, knead the Dubai, Sichuan, and Chushi points with any fingers for 1 to 2 minutes. 3 to 5 times daily until distension is produced on the skin. Regularly massaging these acupoints can dispel wind and dampness, disperse wind and cold, relax joints, clear the meridians, and relieve pain caused by rheumatoid arthritis. As seen in the photo above, all points are there. Thank you for your attention. Interviewing. Let's talk about lack of libido. Lack of libido in men is usually related to a deficiency of qi or yang, most frequently of the kidneys. However, other organs may be relevant, and a severe qi deficiency of such organs as spleen, heart, or lungs also may cause lack of libido. In my experience, a deficiency of the heart is a more common cause of lack of libido than deficiency of the kidneys. Among full conditions, liver qi stagnation may also cause lack of libido. In Chinese medicine, libido depends on the state of the fire of the gate of life, the Mingmen, which represents the fire within the kidneys and is also called the minister fire. A deficiency of this fire may cause lack of libido in both men and women, and also infertility, whereas an excess of this fire may cause excessive sexual desire. Let's talk about kidney yang deficiency. There would be lack of libido. There may be lower back ache, cold knees, feeling cold, bright white complexion, weak knees, tiredness, lassitude, abundant clear urination, urination at night, pale and wet tongue, deep, weak pulse. Now with heart yang deficiency, there may be lack of libido, premature ejaculation, palpitations, shortness of breath in exertion, spontaneous sweating, slight feeling of discomfort or stuffiness in the heart region, pale and wet tongue, deep, weak pulse. In heart blood deficiency, there may be lack of libido, palpitations, dizziness, insomnia, dream disturbed sleep, poor memory, anxiety, propensity to be startled, dull pale complexion, pale lips, pale and thin tongue, a choppy or fine pulse. In heart and spleen blood deficiency, there may be lack of libido, palpitations, dizziness, insomnia, dream disturbed sleep, poor memory, anxiety, propensity to be startled, dull, pale complexion, pale lips, poor appetite, loose stools, tiredness, pale and thin tongue, and a choppy or fine pulse. And liver qi stagnation, there may be lack of libido, hypochondrial or epigastric distension. There may be irritability, moodiness, feeling of a lump in the throat, and a wiry pulse. On a clinical note, in my experience, lack of libido in men is often caused by a heart deficiency, whereas in women, by a kidney deficiency. Thank you for your attention.
Let's now discuss one liu or warm current of the Han-Yang-Ming large intestine meridian. Li7 or 1 liu is located on the radial and dorsal side of the forearm, 5 June proximal to the dorsal wrist crease yang qi. Li7 or 1 liu is the qi cleft or accumulation point of the Li meridian. As the various names for this point indicate, it is a very useful point to bring warmth and movement to the large intestine official. Some people with an imbalance in metal, whether primarily in the lung or the large intestine, find it difficult to maintain their own heat without an outside source. When this coldness affects the mind and spirit, the person may feel despondent and isolated. They have no internal place for comfort and can be unable to be expansive and connect to other people. This point is excellent with moxa. Up to 30 cones may be used. Blood and qi gather at qi cleft accumulation points, making them good points to use when nourishing and strengthening our qi issues. The revitalization afforded by these points, which are not command points, even though they are located in command points territory, has given them the reputation of being like a periscope. They have fostered a new outlook and appraisal of circumstances. All qi cleft points are useful for invigorating or dispersing pain or obstruction along the particular channel on which they are found and are much used in acute conditions. Warm current can clear fire from the large intestine and stomach or the Yang-Ming, and so assist with the problems that affect a fire-afflicted Yang-Ming. Example, hysteria, madness, seeing ghosts, boils, and fevers. Not many points on the Li are mentioned for directly affecting the digestive processes, but Li7 is mentioned in relation to borborygmi with abdominal distension. Warm current regulates the Li meridian. Li7 benefits the throat and can help when there is difficulty raising the elbow. This point is indicated to calm the spirit for acute pain along the Li meridian and for cold in the Li meridian. This point can be used to warm a metal constitutional factor who is physically or emotionally cold, inert, withdrawn, or despairing, and it can take a lot of moxa up to 30. It is said to treat madness, the seeing of ghosts, mania, and hysteria. It nourishes, strengthens, and invigorates the meridian. Consider for acute conditions associated with this official. Thank you for your attention.
Let's discuss differential diagnosis, Western and Chinese medicine, tinnitus, and deafness. Number 1, external ear. Letter A, foreign body. Tinnitus with sudden, painful, partial hearing loss, earache, fullness in the ear. Letter B, wax buildup. Tinnitus with sudden, painless partial hearing loss, earache, fullness in the ear. Number 2, middle ear, otitis media, acute and chronic, tinnitus with inflammation, pain, and high fever. Letter B, eustachian, catarrh in eustachian tube, tinnitus with deafness, subjective sounds, retracted membrane, tympani. Letter C, damage to eardrum, tinnitus with earache, ear discharge, hearing loss. Letter D, glue ear, tinnitus with hearing loss and sense of fullness in the ear. Number 3, inner ear, Meniere's disease, tinnitus with dizziness, episodic vertigo, sudden fluctuating unilateral hearing loss, nausea, and vomiting. Letter B, labyrinthitis, tinnitus with hearing loss, pain, high fever. Letter C, tumors, tinnitus with headache, vomiting, behavioral changes, seizure, double vision, aphasia. Letter D, headache, head injury, tinnitus with drowsiness, headache, behavioral changes, aphasia, lack of coordination, slurred speech, blurred vision. Number 4, other causes of tinnitus include drugs like aspirin, quinine, anemia, hypertension, altitude sickness, temporomandibular joint dysfunction, arteriosclerosis. Number 5, other causes of deafness include letter A, noise-induced traumatic loss, gradual bilateral symmetrical hearing loss, tinnitus, noise exposure. Letter B, autoimmune hearing loss, rapidly progressive hearing loss, possibly fluctuating bilateral loss, poor speech discrimination. Chinese differentiation, tinnitus, and deafness. Diagnostic questioning according to number 1, the onset. It is sudden, which is wind, heat, liver fire, phlegm fire. For the gradual, kidney deficiency, spleen Qi deficiency with phlegm dump. Number 2, aggravation and amelioration, worse for stress for anger, that is stagnation of liver Qi, liver fire blazing. Worse with tobacco, alcohol, that is liver fire blazing, phlegm fire. Better for relaxation, stagnation of liver Qi, liver fire blazing, better with rest, that is kidney or spleen Qi deficiency. Number 3, excess or deficient tinnitus, full pattern, sound of frog or tide, liver fire blazing, phlegm fire. Deficient pattern, fine sound or cicadas or flute pipe, kidney yin deficiency, center Qi fall. Number 4, etiology, emotional strain, like anger, frustration, resentment, excessive sexual activity and overwork, old age, poor diet, exposure to loud noise, loud sound, kidney deficiency, external wind in the channels, sanjiao, gallbladder, small intestine, and taiyang. Stagnation of liver Qi, liver fire blazing, phlegm dump. Sangpo pattern for the excess, wind, heat invading the lung, stagnation of liver Qi, liver fire blazing, phlegm dump, phlegm fire, blood stasis. For deficiency, kidney yin or essence deficiency, spleen Qi deficiency with phlegm dump, center Qi fall with dump obstruction, heart blood deficiency. Thank you for your attention.
Let us now talk about the technique for pulse taking. The best time for taking the pulse is in early morning when both the external and internal conditions of the patient are relatively quiet and his qi and blood are calm. At this time, the pulse profile can more accurately reflect the state of the Zangfu organs and the condition of the qi and the blood. Since the physician cannot always choose the time, the pulse may be taken at any time with satisfactory results provided the examination room is relatively quiet and the physician is calm and attentive. The patient should sit up straight or lie down in a supine position. Place the arm so that the wrist is at the same level as the heart. The wrist should be straight with the palm facing upward. A small pillow under the wrist will help to make the patient more comfortable. Sit opposite the patient. Use the left hand to take the pulse in the right wrist and the right hand to take the pulse in the left wrist. Place the middle finger on the guan position of the radial artery and the index and ring fingers on the tune and chi positions, respectively. The three fingers should be somewhat curled like a bow in order to keep the fingertips at the same level and constantly on the pulse. The spacing between the three fingers should be adjusted according to the height of the patient. For tall patients, separate the fingers slightly, and for short patients, squeeze them together slightly. For a small child, use the thumb alone. 3 levels of pressure should be used in taking the pulse. Using a light force is called touching. Using a moderate force is called searching. Using sufficient force to reach the underlying bone and tendons is called pressing. For complete examination of the pulse, all 3 levels should be used and attention paid to changes in the pulse profile in response to these manipulations. The practitioner should take time examining the pulse, no less than 1 minute and several minutes if necessary. Thank you so much for your attention.
Let's now discuss the second part of pathology of liver imbalances as we continue with diagnosis according to Zhang organ patterns. In general, symptoms and signs that have a close relationship with the menstrual cycle can indicate that there is a liver imbalance, whereas liver excess symptoms typically manifest in the premenstrual period. Liver blood deficiency and liver deficiency signs and symptoms can be more pronounced immediately after or towards the end of menstrual bleeding. The liver has a significant influence on the menstrual cycle. This is due to the liver's close relationship with the movement of qi and blood, and because the liver is a reservoir for blood and supplies the chongmai with blood, thereby enabling menstrual bleeding. If there is liver blood deficiency, there can be too little blood to create menstrual bleeding. This will result in either amenorrhea, scanty menstrual bleeding, or a long menstrual cycle. The cycle can also be longer when there is a stagnation of liver blood. In these cases, the stagnation of blood will not only delay the menstrual bleeding, but also the menstruation will be painful with a sharp, stabbing pain that is constant and fixed in its location. The menstrual blood will be dark and clotted, and the passing of clots will often ameliorate the pain. Dysmenorrhea can also be a manifestation of liver qi stagnation. In these cases, the pain will be more spasmodic and cramping in nature. The cycle can be irregular when there is liver qi stagnation. This is due to qi and blood not flowing smoothly and rhythmically. The stagnation of qi in the liver channel can result in the breast being tender or swollen. Mood swings in the premenstrual period are another classic sign of liver qi stagnation, especially if the woman is more irritable than normal. Liver blood deficiency can manifest with a woman being weepy and sensitive during this period. The stagnation of liver qi in the premenstrual period can also disrupt the functioning of the spleen and the stomach. This means that there can be abdominal bloating, irregular or loose stools, edema, and an increased craving for sweets during the premenstrual phase. Stagnated liver qi can become rebellious and invade the organ in the middle jaw, disrupting the qi dynamic. If the liver qi is stagnated, or if the stomach and or spleen qi is weak, the liver can invade these organs. This will lead to symptoms such as abdominal pain or bloating, alternating constipation and loose stools, or belching. Liver fire can invade the lung, resulting in cough with yellowish or bloody sputum, dyspnea, and chest oppression. Bloating, distension, and pressure are some of the main characteristics of liver qi stagnation. When qi stagnates, it creates a greater tension or pressure in the area. This can give a sensation of being distended or bloated, and it is this sensation that is critical, not whether there is actual physical bloating. If the area is bloated or swollen, this will be just a confirmation that there is a stagnation of qi in the area. As well as disrupting the middle jaw, liver qi stagnation can cause costal pain or chest oppression, where there will be a sensation of the chest being bound by a strong elastic or a metal rim. The stagnation of qi in the upper jaw can result in difficulty with breathing deeply. The liver is physically located just below the costal margin. The liver and gallbladder channels traverse this area. This means that when liver qi stagnates, there can be tension in the hypochondriac region. This is interesting because it is a defining sign of liver qi stagnation in Chinese medicine textbooks. However, not many Western patients report it. If, on the other hand, you ask Western patients whether they have tension in the diaphragm and the solar plexus, they will often say yes when there is liver qi stagnation. Liver qi stagnation will often, over time, generate heat in the liver. This can ultimately lead to liver fire, but in milder cases, it will just result in emergence of heat signs such as thirst, rapid pulse, red cells of the tongue, irritability, and so on. Thank you for your attention.
Let's discuss in inspection the tongue. The tongue is directly or indirectly linked to all the visceral organs and thus closely reflects the state of qi, blood, and body fluids. It is a mirror for the internal organs, so inspection of the tongue is one of the most important techniques of diagnosis. Number one, basic tongue diagnosis. Different parts of the tongue corresponds to different visceral organs. The tip of the tongue corresponds to the heart and the lungs, the middle part to the spleen and the stomach, the root to the kidney, and the two sides to the liver and gallbladder. However, any clinical information so obtained must be analyzed in conjunction with information about the coating as well as the texture of the tongue. During inspection of the tongue, the patient should face the light with his tongue protruding naturally for observation. Inspect the coating first, then the body of the tongue. Pay special attention to the effects of the light and the seasons, and disregard the staining due to food, drink, and drugs. So here is the illustration. The frontal tip is the heart. The center is the spleen, stomach. The sides is the liver and gallbladder, and the posterior part, the root, is the kidney. The contents of tongue diagnosis. Inspection of the tongue encompasses observation of the texture and coloring of the body and the coating of the tongue. The body refers to the structure of the muscles and blood vessels of the tongue, whereas the coating refers to the residue of the surface of the tongue. In Chinese medicine, the coating is formed from steaming by qi ascending from the spleen and the stomach. The body of the normal tongue has these features. It is supple and nimble. Its color is slightly red and bright. It is neither fat nor thin, and it is normally shaped. The normal coating is thin and white, moist but not wet, and neither greasy nor sticky. There are clearly discernible grains that are evenly spread. These grains are rooted and cannot be scraped off. The normal tongue is usually characterized as a light red tongue with thin and white coating. It is important that the tongue and its coating are analyzed together, but there are differences in emphasis. In general, the tongue body is more important for assessing the state of the internal organs, and the tongue coating for assessing the degree of severity of the illness and the adequacy of stomach qi. Thank you for your attention.
Let us now go to epigastric pain. The topic is stomach heat and stomach fire. The clinical manifestations of stomach heat is burning epigastric pain, thirst, irritability, and sour regurgitation. The tongue will be dry with a yellow tongue coating, and the body color may be red if there is pronounced heat. Otherwise, it could look normal. The pulse will be slightly rapid, slightly overflowing in the right middle position, and this pattern is not a common cause of epigastric pain. As treatment principle, we clear stomach heat and restore the descending of stomach qi. Stomach 21 and stomach 44 are used with a reducing or even method. Stomach 21 is a local point for all excess patterns of the stomach, and stomach 44 is the main distal point to clear the stomach heat. As dietary advice in a person with stomach heat, they should avoid eating too much hot energy food such as game, lamb, beef, and spices. Alcohol consumption should also be kept at a minimum. The clinical manifestations of stomach fire is burning epigastric pain, thirst with desire to drink cold water, dry mouth, severe irritability, bleeding gums, vomiting of blood, red face, and constipation. The tongue body will be red or dark red, and the coating will be yellow and dry. The pulse will be rapid, deep, and full. This pattern could be considered a further stage of stomach heat. Heat and fire are very similar in nature and share common manifestations. However, fire is a more substantial pathogenic factor than heat, and it differs from heat in three respects. 1. It dries up more, hence the dry stools, dry mouth, and dry tongue. 2nd, it causes bleeding by agitating the blood in the vessels, hence the bleeding gums and vomiting of blood. And 3rd, it affects the mind more, hence the severe irritability. Fire differs from heat also in its depth. Fire is at a deeper energetic level than heat, so that while heat can be cleared with pungent cold herbs, fire can only be drained with bitter cold herbs. When applying treatment with acupuncture, the distinction between heat and fire is not crucial. However, in herbal therapy, this distinction is important as to clear heat, one uses pungent and cold herbs, while to clear fire, bitter and cold herbs are used. This pattern is not a common cause of epigastric pain. The treatment principle is to drain stomach fire, protect stomach yin, and restore the descending of stomach qi. The points to be used are stomach 44, bladder 21, stomach 45, stomach 21, spleen 6, and Ren 13 using the reducing or even method. Stomach 44 and bladder 21 clears stomach fire. Stomach 45 clears stomach fire and calms the mind. It is the main point to calm the mind when it is disturbed by stomach fire. Stomach 21 is used in all excess patterns of the stomach. Spleen 6 is used to protect stomach yin, and Ren 13 is used to subdue rebellious stomach qi. In this case, stomach qi rebels upwards due to the rising of stomach fire. The same dietary advice is given to a patient with stomach heat. Thank you so much for your attention.